Okay, today's teaching lesson, if you will, on my YouTube channel is tarsal tunnel surgery. And tarsal tunnel surgery is extremely common, or it should be extremely common. I think it's probably well underdiagnosed and or misdiagnosed as plantar fasciitis. But in this particular case, the good doctor here, who I operated on twice in the last couple of months for tarsal tunnel, he basically was starting to get symptoms in his feet. I'll let him explain that for a second, what was going on.
Yeah, for about a year I was getting a painful tingling, cold, numbness, hot. The feelings from my feet were not like the feelings of the rest of my body. I saw a neurologist, I saw my general practitioner, I talked to my cardiologist about it. They all thought it was attributable to pre-diabetes. I have pretty low, I have exaggerated sugar levels, but it's not that bad. And so they kind of wrote it off. And then I got a link inviting me to join Dr. Bregman on his LinkedIn affiliates, and he said specialist in peripheral neuropathy. So I thought I'd get a fourth opinion, and he referred me for an EMG. It showed positive for tarsal tunnel. He didn't promise me any relief, but I'm about 6 or 8 weeks post-surgery on both feet, and I have some numbness, which was expected from the surgery, but the painful, distracting feelings that would keep me up at night and make me feel miserable during the day, those are right now gone.
Awesome. So people who are struggling with tarsal tunnel out there and they see these big incisions and they're not really doing well, one of the first things that we did with you was get you back on your feet immediately, right?
Yes.
There was no period of weight bearing or sitting around doing nothing. We just wanted to get you moving right away.
Yes.
And if we can look at these incisions, now fortunately, the good doctor here had some skinny feet, or let's say they weren't very zoftic, and I was able to make these special incisions where the incision, typical tarsal tunnel incision, runs from about here all the way up to here. These are made in a different plane, and as you can see, they heal really, really well. And whenever possible, if we can do this incision, that's going to speed the recovery, yet I can still get to all the anatomy that I need to get to accomplish the mission. So I think it's important that if you have general heel pain or paresthesias or some of the symptoms that Dr. Whiteman was speaking about, I think you need to go see someone who understands how to deal with this. And unfortunately, there's very few surgeons and or doctors who really understand this. And so, hopefully with this video and the blessing of Dr. Royman here, we can post this and certainly make sure that we're educating people. Okay, thank you. Thank you.